we can cure it and the patient can be completely cured of this cancer. Although in our country sometimes it is difficult to find patients during this stage of cancer, we still make a point that we screen every patient who comes to our OPD for cervix and cervical cancers and make sure that they are not going towards it. So yes, if detected early, these patients can be treated and can be completely cured of cervical cancer. Hello, good morning. I'm Dr. Dimple Chudgar, gynecologist and laparoscopic surgeon, and today in this video we'll be talking about cervical cancers. So cervical cancer is a cancer of the mouth of the uterus, which is called the cervix, and it can be detected by a very simple method called as a pap smear, which can be taken in a regular OPD. We have now shifted to a liquid-based cytology which also detects human papilloma virus, that is the HPV virus, along with any abnormal cells in the cervix. So both can be treated, the cervical cancer as well as if there is a virus associated with it which is causing it, it can be also treated. So now we have shifted to something called as a liquid-based cytology, and it's very easy to do it in a regular OPD. So I would advise all patients in the age group of 9 to 11 to take cervical cancer vaccines. Of course, beyond age 11 to whenever the child becomes sexually active, all the parents should ensure that the children take, the girls especially, take cervical cancer vaccines. Of course, the boys are in the age group of 9 to 18 are also encouraged to take HPV vaccines to prevent wart formation as well as transmission of HPV to their partners. So before the child becomes sexually active, we advise the parents to take the HPV vaccine for both girls as well as boys. That's the first step. Second step is once the girl becomes sexually active, we advise yearly pap smears or liquid-based cytology, as I mentioned earlier, to be done every year or at least once in 2 years. So that will prevent cervical cancers in most patients. If the patient is diagnosed with abnormal pap smears, we can offer curative therapies for such patients and can prevent them from going into stage 2 and beyond of cancers. Cervical cancers, if diagnosed early, that is within stage 2A, before stage 2A, we can cure it and the patient can be completely cured of this cancer. Although, in our country sometimes it is difficult to find patients during this stage of cancer, we still make a point that we screen every patient who comes to our OPD for cervix and cervical cancers and make sure that they are not going towards it. So yes, if detected early, these patients can be treated and can be completely cured of cervical cancer. Of course, if a woman is in a reproductive age group and is diagnosed with cervical cancer, such patients, if they are diagnosed earlier, we can provide them with curative therapies like cone biopsy of the cervix. If it is diagnosed very early, say in stage 1A or 1B, we can offer cone biopsy or a radical trachelectomy, which means that that part of the cervix is removed or the cervix is removed and the uterus is preserved, and we can offer such patients to get pregnant with their intact uterus. If the patient is diagnosed at a later stage of cervical cancer, we also offer nowadays to store their eggs before we give them radiation or chemotherapy and can get their embryos from those eggs and take a surrogate. So yes, the patient can definitely hope for a pregnancy. So treatment for cervical cancer will depend on the stage of the disease. So if we diagnose the patient early in the stage, then we can offer surgery which can be completely curative for this patient. patient may or may not require chemotherapy or radiation depending upon the stage of the cancer. But if the patient comes at a later stage, as I said, after stage 2A, then this patient may require surgery as well as chemo and radiotherapy. If the patient is diagnosed early, then definitely the patient can be cured with surgery. So if you're facing any problems with your cervix, or if you feel you have symptoms of cervical cancer, do contact us at Apollo Spectra and we'll be happy to help you. Thank you.